all other Western European countries had a lower level of excess death.
I don't wish to contradict you, Mr. Keith, but the evidence, the ONS data I saw put us, I think, about 16th or 19th in a table of 33.
I'm sorry, if you don't sit down, I'm going to ask the ushers to get you to leave. Right, ushers, please, could you ask them to leave?
I think I did once or twice look at maybe more than that. I looked at what Sage had actually said, and Sage certainly produced a lot of documentation. I look at all this stuff in which we seem so oblivious with horror now. I mean, we should have twigged. We should collectively have twigged much sooner. I should have twigged. Evidence I shall give shall be the truth, the whole truth, and nothing but the truth. By your leave, my lady, can I just say how glad I am to be at this inquiry, and how sorry I am for the pain and the loss and the suffering
sit down.
Of
please
the
stop.
COVID victims.
Please sit down. Please sit down, or I'm afraid you'll have to leave the hearing room. I'm sorry, if you don't sit down, I'm going to ask the ushers to get you to leave. Right, ushers, please, could you ask them to leave?
Could I say, by your leave, that I understand the feelings of these victims and their families, and I am deeply sorry for the pain and the loss and the suffering of those victims and their families.
Reinstalled and disclosed.
That's right.
Do you know why your phone was missing those 5,000 odd WhatsApps?
I don't know the exact reason, but it looks as though it's something to do with the app going down and then coming up again, but somehow not automatically erasing all the things between that date when it went down and the moment when it was last backed up. So I can't give you the technical explanation, but that's the best I'm able to give.
May I just ask you this? Was it you, if that was a factory reset that was done, was it you that tried to reset the phone or not?
A factory reset?
There is a device or a capability on the phone which allows its contents to be entirely reset. That wasn't you.
I don't remember any such thing.
All right.
And the avoidance of doubt, make it absolutely clear, I haven't removed any WhatsApps from my phone, and I've given you everything that... Inevitably, we got some things wrong. I think we were doing our best at the time, given what we knew, given the information I had available to me at the time. I think we did our level best. Were there things that we should have done differently? Unquestionably, but I would struggle to itemize them all before you now in a hierarchy. I'm afraid. I think it would be. I'd find it easier to try and explain what happened as we went through.
You say in your witness statement, I unquestionably made mistakes. Can you draw a distinction for us, please, between yourself personally and the government? To what extent do you accept personal responsibility as opposed to accepting it on behalf of your administration?
So I take personal responsibility for all the decisions that we made.
It's obvious, Mr. Johnson, that many of the most difficult and momentous decisions rested upon your own shoulders as Prime Minister. Do you take responsibility for whatever my lady makes of the speed of the government's response in January, February, March of 2020?
Of course.
And the way in which the various moving parts of the government, the advisory committees, the departments, the agencies and so on responded?
Of course.
Do you take responsibility for the lockdown decisions, whichever way they went, and their timeliness, whatever my lady makes of them? the manner in which patients were discharged from hospitals into the care sector.
Of course.
The explosion of the virus within the residential care sector.
Yes.
The general speed at which the restrictions were eased.
Yes.
The Eat Out to Help Out scheme. And then, latterly in 2020, the decision not to introduce a circuit breaker in September or October, or to introduce a tier system earlier when the prevalence of the virus was lower, for good or ill.
Yes, though we did have local restrictions from a very early day.
The evidence before Milady is that the United Kingdom had one of the highest rates of excess death in Europe. Almost all other Western European countries had a lower level of excess death.
I've seen.
Italy was tragically in a worse position than the United Kingdom.
Well, I don't wish to contradict you, Mr. Keith, but the evidence, the ONS data I saw put us, I think, about 16th or 19th in a table of 33.
In Western Europe, we were one of the worst off, if not the second worst off.
The UK, from the evidence that I have seen, was well down the European table and obviously even further down the world table. If I had to answer why I think we face particular headwinds, I would say it was irrespective of government action. We have an elderly population, extremely elderly population. We do suffer, sadly, from lots of COVID-related comorbidities. And we are a very, very densely populated country, the second most densely populated country in Europe, and that did not help. If I had to make a comment about Cabinet as a whole in terms of the speed of lockdowns, which was what we're talking about, I think it probably would be fair to say that the Cabinet was, on the whole, more reluctant to impose MPIs than necessarily than I was. That wasn't true.
SAGE minutes were described as consensus minutes because they were designed to be read at speed, to be able to get to the heart of the issue immediately on reading them, and to ensure that the advice that was being given would be readily and speedily understood. Did you ever think of calling as a general practice for those minutes so that you could yourself read them? Many of them were only 8 or 9 pages long.
As I say, I think I did, from time to time, look at the consensus minutes. I think, in retrospect, it might have been valuable to try to hear the SAGE conversation unpasteurized itself. But I didn't. And I was more than content with the very clear summaries that I was getting from the CSA and the CMO.
There were hundreds of consensus minutes, but you read only, or were given only a fraction of them.
That sounds right to me, yes.
Do you suggest that there was an absence of a proper advisory structure to deal with the other issues and the other considerations which weighed in the balance when you came to make those final decisions?
I've thought about that a great deal, and I think in the end that there is such a body, and it's called HM Treasury, and that is what they do. And you referred earlier on, Mr. Keith, to the competing perspectives of the Whitehall departments and the secretaries of state, and I think for all its difficulties, I think it did work well in allowing me to get a balance of the argument. Material,
so that's to say diary entries and readouts of minutes and so on, Mr. Johnson, show that the Chancellor of the Exchequer would, in this difficult context of making the ultimate decisions about lockdowns and easing and tiers and so on, often get the last word by way of a bilateral meeting that would take place just before you made a final decision. And also the Secretary of State for Health and Social Care was occasionally excluded from meetings when public health matters were being discussed. Were you aware of that?
I think that's I reject that characterisation of what took place. The overwhelming priority of the government was protect the NHS, save lives. That was our objective. And I would submit that any powerful and effective government has, and I think of the Thatcher government or the Blair government, has a lot of challenging and competing characters whose views about each other might not be fit to print, but to get an awful lot done. And that's what we did.
Were you aware that there were individuals, civil servants and advisors who were not prepared to work in your administration because of the atmosphere and the working relationships which were in play?
First of all, no. Second, I was not aware of that. Secondly, I didn't see any sign of that. I saw brilliantly talented people. When we advertised for a post, when we wanted to recruit for a position in my private office, we had, as far as I could see, no difficulty getting wonderful people to step forward. I think, if I might make one self-criticism, or another self-criticism, I think that the gender balance of my team should have been better.
The Permanent Secretary number 10 WhatsApped you yourself on the 2nd of July to say that lots of people, lots of top drawer people had refused to come because of the toxic reputation of your operation.
Well, I don't remember that.
What did you do?
I don't remember that. And my impression was that we had no difficulty recruiting the best possible people.
These are communications between Mr. Cummings and yourself in May 2020. We're concerned with the bottom half of the page.
So can you expand it, because I can't?
Yes, 7th of May, Hancock is unfit for this job. The incompetence, the constant lies, the obsession with media bullshit. Reference to testing, you must ask him where we'll get to 500,000 per day and where's your plan for testing? And if you can scroll back out.
But
just,
sorry,
just pause a second, Mr. Johnson. If you then scroll in, please, to the bottom half of the page, the last part. Mr. Cummings says, it'll certainly be a cock-up like everything else, but it'll be far from the worst of our cock-ups over the next 8 weeks. You need to think of Binny Hancock, and so on and so forth. You cannot suggest that you are unaware of the opinion taken by your chief advisor over your Secretary of State for Health. You cannot suggest you are unaware of the concerns expressed by your Cabinet Secretary about the toxic reputation of your operation, because he WhatsApped you directly. You cannot suggest that there weren't grave concerns being expressed in Downing Street, that there were people who simply would not come and work for you because of the atmosphere you allowed to develop.
So, first of all, in politics, there's never a time when you're not, if you're Prime Minister, you are constantly being lobbied by somebody to sack somebody else. It's just what I'm afraid happens, and it's part of life. Everybody's constantly militating against some other individual for some reason of their right. It's just that I'm afraid that's the nature of it. And the problem that I was facing, and it was an appalling problem, in October, was that we didn't have therapeutics, or we didn't have, well, we had some therapeutics, but we didn't have a vaccine, we didn't have a way out, a medical solution. We were being forced to use NPIs, and at this particular moment, I'm sure we'll come to the October-November lockdowns, my anxiety was that we were going to have to do the same thing over and over again. And I think what those notebooks reflect and what all those comments reflect is the deep anxiety of a group of people doing their level best who cannot see an easy solution and are naturally self-critical and critical of others.
Were you even aware that Mr. Hancock was chairing COBRAs to deal with a new and emerging respiratory virus on those 5 dates?
I think that I was aware that Matt was handling it. I couldn't swear that I was aware that he was handling it in that way on all those particular dates. My instructions to him were to keep me posted, and I would do whatever I could. But by the end of the month, clearly, by the end of February, I'm getting anxious about what we're doing.
27th of March, after Mr. Cummings had asserted that Whitehall had nearly killed huge numbers of people and cost millions of jobs, and that Mr. Hancock had failed to get on top of the testing problems, you yourself said these 3 words, totally fucking hopeless. That was a reference to the performance of an important part of government.
I'd stress the word nearly in that.
Your response, Mr. Johnson.
And I would say that my job was not uncritically to accept that everything we were doing was good, though as it happens, as I said to you, I do think that the country as a whole had notable achievements during the crisis. A lot of the language, the style that you refer to is completely unknown to me, or indeed to anybody else not on that group. In that period, January really to the end of February, towards the end of February, COVID was pretty much like a cloud on the horizon, no bigger than a man's hand, and you didn't know whether it was going to turn into a typhoon or not. And I certainly didn't. I was unsure, and it became clear much later.
The government failed to wake up, did it not? It failed to understand the significance of the crisis, and therefore, it must follow, failed to take steps speedily enough.
I think that it would certainly be fair to say of me, the entire Whitehall establishment, scientific community included, our advisors included, that we underestimated the scale and the pace of the challenge. If we had collectively stopped to think about the mathematical implications of some of the forecasts that were being made, and we believed them, we might have operated differently. The problem was that I don't think we attached enough credence to those forecasts.
On the 27th of March, after Mr. Cummings had asserted that Whitehall had nearly killed huge numbers of people and cost millions of jobs, and that Mr. Hancock had failed to get on top of the testing problems, you yourself said these 3 words, totally fucking hopeless. That was a reference to the performance of an important part of government.
I'd stress the word nearly in that.
Your response, Mr. Johnson.
And I would say that my job was not uncritically to accept that everything we were doing was good, though as it happens, as I said to you, I do think that the country as a whole had notable achievements during the crisis. A lot of the language, the style that you refer to is completely unknown to me, or indeed to anybody else not on that group. I've apologised to one particular person who suffered abuse in one of those publicised WhatsApp exchanges. But I would make a distinction between the type of language used and the decision-making processes of the government. And what we got done, the scenes from Italy really rattled me. And it was, I thought, I remember seeing a note somewhere saying that the fatality rate in Italy was 8%. Because they had an elderly population. I thought, well, my God, we've got an elderly population. This is appalling. And this can't be. And I thought my instinct was this cannot possibly be right. This number. I mean, just so you know, I look at all this stuff in which we seem so oblivious with horror now. I mean, we should have twigged. We should collectively have twigged much sooner. I should have twigged.
Despite being, as you've said it yourself, seriously rattled by the news of Italy, did the tempo of work on coronavirus nevertheless dip during the half-term break that followed?
I noticed that you've been over that period in your previous interrogations in this inquiry, and I hope the inquiry is satisfied that actually there wasn't a long holiday that I took in that.
And you personally, well, let me ask you,
because I think that there was some misapprehension.
You carried on working,
and in that very period, I rang President Xi of China to offer her the UK's condolences for what was happening in China, to discuss the origins of COVID and to compare notes on what was happening. I also, I think a couple of days later, rang President Trump in America to discuss exactly the same thing. So it was despite what has previously been said to the inquiry by some of the evidence, there was a lot going on, and it really starts to mount in tempo round about the time that we get Catherine Hammond's note of the
on the 28th of February.
28th, yes.
So the question to you, Mr. Johnson, is this, and nobody is suggesting you put your feet up at Chevening during that week.
Well, apart from you, that is.
Well, I'm
a conversation I happened to catch on the between you and a previous witness, in which I thought the impression was being given by somebody that I was relaxing during that period.
I think it was Mr. Cummings.
It may have been,
and not given by me, Mr. Johnson, but by the witness.
I take it back unreservedly, Mr. Keith, and I apologize. I had to level with the public and say I'm afraid a large number of people are going to lose their loved ones before their time, and it was a pretty grim press conference. And in that discussion, we were asked about how the way through, and I think Patrick said the idea was to flatten the curve, suppress the virus, with some measure of herd immunity by September being, I think, a good outcome, was what he said. And I think he also said something to the effect of, it might not be, you need to suppress the curve, but not. It might not be necessary to stop everybody, or even desirable to stop everybody getting the virus, because again, you might want some measure of herd immunity. Anyway, that was the moment when people all pricked up their ears and say, are they trying to allow this thing to just pass through the population unchecked, with a view to establishing herd immunity, which was not what we wanted, not what Patrick meant. And we had to do quite a lot of work to clear it up, because our objective was to protect the NHS and save life, and to save life by protecting the NHS. That was our objective. Our strategy was to suppress the curve and to keep the R below 1 as much as we could. We were going to use everything we could to do that. Herd immunity was going to be, we hoped, a byproduct of that campaign, which might be very long and very difficult.
The red line, freeable beds, and the black line, total NHS beds, make plain that whatever you do, unmitigated or mitigated through measures 1 and 2, the NHS will be massively overwhelmed.
Yes.
What did you make of that?
I was bewildered, to be honest. I remember looking at that graph and thinking, in either case, we are facing an absolutely intolerable situation, and but although I clocked it, I thought, well, there must be a reason why we're not being told to go urgently. What I should have done was, as soon as I saw that graph, said, hang on, this is not coherent with what you're telling me about timeliness. Because I do remember looking at it and thinking there was something amiss.